supplies. 3, progress on periodic review of supply agreements to meet the facilities' evolving needs. 4, adequate plans on construction of well-managed and regulated drugstore within the county. Bwana Chief, our second question will be on poor network coverage affecting timely online claims. Could you please kindly provide the committee with the updates on the following? 1, current status on the improvement and expansion of network infrastructure within health facilities across the county, including any challenges encountered and milestones achieved thus so far. 2, if there are ongoing engagements with the telecommunication providers to improve connectivity and facilitate seamless online claims processing. 3, whether measures have been implemented to establish backup system in case of network outages. Our question number 3 will be on delay and inconsistent disbursement of recurrent funds. Could you please provide a brief update on the committee, to the committee on the following critical issue? 1, efforts made by your department in collaboration with the ECM Finance and Economic Planning to streamline the disbursement process for the timely and predictable financial support for the health facilities within the county. 2, in your own opinion, what are the key challenges with this issue and what strategies do you purpose to address them? Question number 4 will be on delays in reimbursement of NHIF and Linda Mama claims. Kindly update this committee on the following. 1, the initiatives your department has undertaken with the NHIF for a lasting solution to consistent delay in reimbursement for services already rendered. 2, whether there are adequate plans for an interim funding framework to mitigate the impact of delaying reimbursements as suggested by the committee. And Bwana Chief, question number 5 will be on the condemned buildings, particularly in areas with black cotton soil and some parts of Kisumu West sub-county. Bwana Chief, following several cases of condemned buildings across the county, could you please inform this committee on what efforts you have put in place regarding comprehensive assessment, whether you have reached out to the Department of Infrastructure, Energy and Public Works on the need to conduct a comprehensive assessment of the structural integrity of the condemned structures in high-risk areas such as Nyang'ande, Sondu, Nyang'oma. What plans are in place for the reconstruction where necessary? And 2, adequate plans. What plans are there to engage engineering experts to assist in designing resilient buildings suitable for local soil conditions? And question number 6, Bwana Chief, will be on acute shortage of staff. Could you please help this committee understand the efforts in your collaboration with the Public Service Board regarding 1, prioritizing staff recruitment and retention at the respective facilities. 2, implementing mechanism for regular workforce assessment and planning. 3, developing a competitive remuneration package. And 4, providing professional development opportunities to attract and retain healthcare professionals. Question number 7 will be about inadequate waste disposal system and threat to environmental and public health. Kindly enlighten this committee on actionable plan regarding 1, purchasing and installing of burning chambers in all sub-county hospitals. As you are aware, this initiative aims to enhance waste management practices and protect public health and contribute to environmental sustainability for a healthier community overall. Number 8, which is my last question, will be on the lack of title deeds for the facilities. Bwana Chief and the team, given enormous challenges caused by lack of title deeds to the facilities, could you please provide an update on progress made in collaboration with the Department of Lands, Housing and Physical Planning and Urban Development to establish clear ownership and secure long-term presence for the hospitals on the land? Thank you, Bwana Chief.
Yeah, it is your time to answer to the questions that have been raised by Honorable Member James Were. Thank you.
Thank you. Thank you, Chair, and thank you, Honorable James, for the many questions that have been raised by this very wonderful committee. These questions are very serious questions that if we could have answers to them, all answers to them, we have answers to some of them. Generally, a lot of work is in progress, but let me be specific with the questions. Number one is attempting to address the progress with relevant stakeholders to improve supply chain for non-pharmaceuticals. Honorable Chair, the Department of Health has, our main supplier is KEMSA, the Kenya Medical Supplies Agency. However, and we prefer KEMSA for many reasons. One of them is because KEMSA takes these medicines to the facility, the remotest part of Kisumu. A lot of times we prefer dealing with them, and indeed we deal with them. But KEMSA has some challenges. One is that they have a fill rate of around 60%. That means that if you ask them for drugs worth 100 million shillings, they will only provide you with medicine that's around about 60 million. Now, that 40 million difference, we have what is called framework arrangement with the other suppliers, competitive suppliers. I'm sorry about it. Yeah, so the 40%, we have what we call framework procurement system with some private suppliers. So these are the people that once we have called KEMSA, once we have a budget, we have called KEMSA, we tell them we require 2,000 tablets of paracetamol, 3,000 tablets of whatever. They tell us, no, we don't have this, we don't have this, just ask for this. Whatever remains is what we float to the framework team. Now, what is framework team? The framework method of procurement. Framework method of procurement is where we have suppliers agreeing to suppliers at a price. Suppliers as with an item at a price that is agreed for the next 2 years. That means, and we have a list of them, I think we have about 20 or so of them, that then we just choose and say, you suppliers with this amount, you suppliers with this amount. So what I have answered is not just about non-pharmaceuticals. It also applies to medicines. And the second part of the question is whether there is a reliable procurement and distribution system to ensure adequate supply of essential medical supplies. As I've said, Chair, KEMSA does that for us. But those that we get from the people that we call the framework suppliers, we receive them at the medical store at Kisumu County Hospital, and then we distribute from there based on workload of the facilities. Apart from that, Chair, when facilities are budgeting, particularly facilities that are level 4 and 5, that is the Oberkamos, the Shulaimbos, and the Aheros of the world, they also have a little budget that they usually top up, either from the FIF, which is Facility Improvement Fund, or the CRF funds that we push to them. They also top up on what we are not able to supply them with. And for them, their main suppliers, again, are KEMSA. They deal with KEMSA directly, or they deal with what we call MEDS, and I think just KEMSA and MEDS. And of course, there are also some local suppliers that they deal with. Now, how do they choose those people to deal with? Kisumu County Referral Hospital has got, is the point of reference that they use, because Kisumu County Hospital, you could even, if you were keen enough, in the last, I think, 2-3 weeks, they advertised. Kisumu County Hospital advertised. But they advertised on behalf of the other county hospitals, on behalf of Ahero, Paponditi, Muhoroni, Gita, Chulaimbo, and Kombeo, so that KCRH then becomes sort of the central procurement point for the medicines that the facilities themselves buy. Right? Number 3 is progress on periodic review of supply agreements to meet the facilities' evolving needs. Yes, on this one, you know, I would want to look at this from two angles. One is, for example, we are aware of the recent turbulence in the rate of the dollar. And those suppliers that had agreed, for example, to supply you with an item for, say, you know, say 10 shillings, but because of the turbulence of the dollar, the same item now, according to them, should cost, say, 15 shillings. Then they raise issues with our procurement system. And of course, we also do what is called the market survey, and we review the prices. The second prong to this answer, to this question, is to meet the facilities' evolving needs. For example, KCRH is the only facility in this entire county that has got a psychiatric ward. The people with mental illness, all of them are admitted at Kisumu County Hospital. There's no other facility. So Kisumu County Hospital, therefore, has got special needs for special medicine. So mental health medicines, we only supply them to the Kisumu County Hospital. But after the patients have been seen in the wards and they take like 1 month or so, then they are sent home, say, to Paponditi. Paponditi itself then becomes the point where they go for their clinics. And when they're there, Paponditi then looks at the need. And as I said, there is FIF, Facility Improvement Fund, and county funds that we push to them. They can also fill up what their needs are using those facilities. The other part of this question, Chair, is the adequate plans on construction of well-managed and regulated drug store within the county. Yes, this is a challenge, but it is not a completely negative story. You walk into some of our facilities, for example, I'll mention a few. Walk to Kombewa, walk to Oberkamoth, walk to Ahero, Gita. You'll find medical stores that are very well regulated with respect even to temperatures. They are the kind of thing I'm feeling in this building. It's work in progress. Some of our facilities may not have very adequate drug stores. For example, KCRH, our main store. I don't know if you've been there. Really, it is not as strong, but it is in our plans to make it look and function as expected. Chair, I think that ends my response to the first part of the questions. I don't know how you want us to proceed. Whether I go ahead and deal with other issues or we can take questions from there. I don't know how you want us to proceed. I rely on your guidance.
Thank you.
So we are to take all the questions as they appear.
Paper. The same way they were read by honorable member, you take all of them, then after answering all of them, if we have questions to you, want us to proceed.
Thank you, Chair. Allow me to for example, now I've dealt with the first question. If any member of my committee has anything to add, we can easily deal with that. But I guess the director will add to my answers. Number 2, Chair, is poor network coverage affecting timely online claims. Could you please provide the committee with updates on the following? 1, current status on improvement and expansion of network infrastructure within health facilities across the county, including any challenges encountered and milestones achieved with this one. Chair, I must make a confession. This is a big challenge for us. A very big challenge for us. In fact, even right in the center of town, Kisumu County Hospital, we have, as you are aware, Chair and members of this very honorable committee, we are digitizing. Our level of digitization is just amazing. Next time you get out there to see our facilities, you're going to be very impressed with how far we have gone with digitization. So digitization, again, requires quite some good networks. And it means a lot when we have unstable network. I am not really an expert on these network issues, and I don't want to say things that may be used against me later. But I think here I may need to. I have a team actually. I have a team that deals with network, and I wish, Chair, that you even exposed me to the questions before so that I know who to carry. This one was just told come and give a statement. So next time I want to request, unless this is the way that it is lawfully done. But if I had these questions before, my response would have been very detailed, because I know what I will get from this assembly when I behave well. Yeah. Now, for networks, I want to confess this is a big issue. The big issue is going to affect us, but I know something is being done. I don't know. Do you guys remember anything about this idea of web-based? Because I remember, Elephant is web-based. The others are still not web-based. Others are network-based. I hear Odiga and Waziri talk about this better. And I wish I knew this. But Director, you have something to add?
Yes, thank you. Thank you, the Chair. Just to add on the network, in the facilities which are in town, currently the network have improved. Kenya has put what we call the super highway to big towns. and this is a source of fiber network which is at a very high speed. So at KCRH currently, we've connected with the super highway, which Kenya, the government of Kenya is in plan of making 100,000 kilometers of the super highway in the network. Currently, we still have problem, the way our chief has said, on those facilities which are away from town. We talk Seme, Manywanda has the same problem. In fact, even M-Pesa at Manywanda is a problem. To go to Nyamarimba, even M-Pesa message takes time for people even to pay through the pay bill. So in those facilities which are out, we still have a problem on the network issue. But on the digitization, we are more than 85% in fully digitizing facilities in Kisumu County. You know that the shift, the Social Health Insurance Fund, when it takes effect from July, there will be no manual submission of claims. All claims will be done through the digital way. So it is upon us to adopt this, because if we don't with time, then we'll not be able to have any claim and any FIF for our facility to run. So currently we are around 85%. If you go to railway, which is next year is 100%, KCRH is 90-something%, including JOTRH 86%. They have not just included the in and outpatient units. When you go to Kombewa, it's 100%. At Ober Kamoth, it's 99%. You walk in, no paperwork, and you come out. That is what is envisioned in the new insurance health, which is the shift, which is coming soon in July. Thank you. Thank you, Chair. We are working with a partner. We still don't have a backup where we call, we still don't have a web store where we store our data. It's a specific type of structure which is needed, which is fireproof. It requires a lot of things to be put in place. We've had talk with two partners who are willing to put some funds for us to have our data stored, because we cannot have data here in, here out, here nor there. They must be stored, and they are what we call the data protection law that require that we must put that building in place. That building is a special building that is fireproof and has those data, what we call storage capacity. So these two partners that we've talked with have assured us that they will be doing some work in the year to come. So we've not finalized an MOU so that we are sure when we are starting the work to have our data protected and stored. Thank you.
Thank you, Don, and thank you, Chair. Then, Chair, with your permission, Chair, we then want to move to the third part of concerns that have been raised by this very honorable committee. Could we please provide brief update to the committee on the following critical issues? One is efforts made by a department in collaboration with finance to streamline disbursement processes for timely and predictable financial support for health facilities within the county. Chair, on this one, we have, our facilities have three sources of funding. One is the Facility Improvement Fund. That is what they collect. at the source, otherwise called on-source revenue. And this happens with level 4 and 5 facilities in Kisumu County. Their second source of support, Chair, is from the County Revenue Fund, CRF. That is money that we get from the Exchequer, Kisumu County, and then we take to them. And the third source, Chair, is some of our facilities deal with partners directly, of course, with our engagement. They deal with partners directly. Some partners give support in kind. Other partners give financial support. But we're on top of things and we know exactly what they are doing. This question, Chair, is concerned with the predictable financial support to health facilities within the county. FIF is very predictable. Facility Improvement Fund is very predictable. Chair, predictable in the sense that they collect funds. And as we have said before, this collection now is through pay bill in 100% of our facilities. We were doing around 80% up to 2 weeks ago, but now in the last 2 weeks, our 9 facilities which were remaining are now been roped into pay bill. So our facilities are cashless. Now this money paid by pay bill then goes into an account. That account is being managed by the finance department with our support, of course. And then at the end of every quarter, this money is then wired back to the facilities. Not for use still, but they will then see that they have, say, collected 1 million Kenya shillings. Facility X, for example, yeah? And then that Facility X then budgets for the money. And if you allow me, I can take you through the process of that budget. I know it's not part of this question, but for purposes of understanding what I'm going to say next year, let me explain how this happened. Facility X have collected 1 million shillings, for example. The medical superintendent of the facility in charge then calls what is called the CHMT, not CHMT, HMT, Hospital Management Committee. They sit down and the MedSup says, ladies and gentlemen, we have 1 million shillings to budget with, all right? But, so each department then says, we want this, we want this, we want this, and you cost. But then the MedSup also says that there are things we cannot debate about, things that we must deal with directly. One is, of course, we have made a decision that casuals this time, we are paying them their 2 months delayed salaries. We must pay for electricity, we must pay for water, and also we may want to buy a few things that are mandatory. Then that money probably remains like 700,000 shillings. This amount of money, Chair, then the departments bring their needs. The nurses will say we need 20 syringes, 40 syringes, a few needles. The kitchen will say we need 20 kilograms of meat. Every department then brings their needs. And then, once that is done, you'll find that the total cost of what they require is, say, 3 million, while you have 700,000 shillings. So then they're told, now you need to prioritize. If you want 20 syringes, we can't afford. We will give you 17 syringes. And that negotiation goes on to the extent that now it is 700,000 shillings. Then that agreement then is taken to a committee called the board. Every hospital has a board that is representative of the community around there. In the board meeting, the MedSup then presents this need. And then the board either ratifies or the board also says, no, you can't do this, you can't do this. That gate is falling, that gate needs to be painted, please factor it in. Once that is agreed, that document is brought to the office of the chief officer. The chief officer then also has, veto power over some of their requests, because you also get to meet very wild requests. They may say they want to pay all the money they want to pay cash-wise. So you ask them, no, but are we paid for water? What about electricity? That's why sometimes you hear electricity may quite disconnected. Yeah. So the chief officer then guides on, tell us, what about medicines? Do you have enough medicine? Occasionally, I even send people to go and see their store. All right? Once that is agreed, then we give them what is called an AIE, Authority to Incur Expenditure. Then they go and begin the procurement process at their facility. But I want to say this. One thing that Kisumu County stands out for is that our facilities get 100% of their money back. The county does not remain with a single coin from the facilities. And I want to thank this assembly entirely for giving us the first FIF Act. We were actually among the first 5 or so counties to see the need that our facilities get back all their money. And I will not get tired, because I mentioned this to all the other counties. When I meet my colleagues, they say, oh, as you collect $1 million shillings, you only get 200,000. I say, no, our assembly is very strong. They have given us the support, and we are getting everything that we get. Chair, the second part of this question is, in your opinion, what are the key challenges with the issue, and what strategies do we propose to address them? Chair, I didn't discuss the CRF part of it. I mean, that's being brought to my attention because of this question. CRF, we look at the workload based on our budget of the money we have to push back to the facilities. That is the money from the exchange. CRF, Chair, we look at the workload and apportion the support depending on the workload. Like in the current financial year, George CRH, we gave them 110 million shillings. KCRH, 42 million. And the other facilities now the other smaller, Aponditi, Aero, Kombewa, now we give them based on the workload. It's pro rata. It is calculated based on how many patients do you see, how many ward beds and stuff. That influences or determines what we give each facility. So I think in your opinion, what are the key challenges with the issues, and what strategies do you put in place to address them? One of the challenges here with this, particularly CRF, I've dealt with the challenges on FIF. And FIF, the challenges at the level of the facility chair is that our people are not very well endowed financially. So we do a lot of waivers. George CRH last financial year, waived 12 million shillings. That calculates to around 1 million a month. Chair, our NHIF coverage in Kisumu County is around 21%. That means that a lot of our people go to the hospital and they're real sick, but they're broke. But we have to treat them. So we do our obligation to treat. Today, Chair, an old man walked into my compound, the village, and he told me his son is in WTRH. He has only 15,000 shillings. The bill is 70,000 shillings. He's coming to me to help him. And I'm sure even in you, the honorable members of this assembly, I know you meet this more than I do, because you represent the people, and in you they see hope and leadership. So I'm sure you guys meet a lot of the kind of thing I am talking about. So that is it. So one of the issues we must do is, in every opportunity that we get, we must tell our people to join NHI. This situation, I think, will be sorted out by the chief. And the chief, is an animal, like an elephant. Those who are blind and touch the ears, they think an elephant is like a chapati. Those who touch the tusk, they think the elephant is rock solid. Those who touch the meat, the abdomen, they think it is soft. So we still do not know exactly how this thing will look like. But we hope, our hope is that a shift, that is Social Health Insurance Fund or Social Health Insurance Authority share, will sort out part of these challenges that I know even you, as members of the Assembly, are really having issues with your people that you honorably represent. Chair number 4, delays in the reimbursement of NHIF or Linda Mama claims. Kindly update the committee on the following. 1, the initiative or initiatives your department has undertaken with NHIF for lasting solution to consistent delays in reimbursement for service already rendered. This is an ongoing engagement. Even today I was signing a document that we are sending to the board, the revenue board, the whole of February, no, the whole of March. Only JTRH got reimbursement of 35 million. The rest of the facilities got nothing. But in April, I think 95% of them got something. 95% all the facilities we have. JTRH, I think this time got around 41. These are, I wish you give me this thing before I can brought those documents here for you people to see. But Chair, this is an ongoing engagement that I have personally worked with the office of the regional manager, not once, not twice, not 3 times, but many times, just to make sure that things continue. With this digitization and shift and share, we hope things are going to be better. But even if they are not, we will deal with it. Whether there are adequate plans for an interim funding framework to mitigate the impact of delay reimbursement as suggested by the committee. Adequate plans for interim funding. Chair, we don't have any other funding. I've told you we have those 3 sources. So there's nothing else that we can do. But we plan. For example, we are sure that after every 3 months, after every quarter, we give them FIF. And you know, CRF, again, we have the ability to predict. Like now, they're using FIF because the finance department is not being supported by the national government for quite a period of time. That explains even the delay in salary. So when we will, so now we are encouraging them and we are giving them the 3rd quarter very quickly. Now they ask for the AIs, they get. But when we know they have some money, when they ask us for FIA with the delay for about 2 to 3 weeks, so that they can exhaust what we gave them, and then we do. So we are, working around our own challenges to make sure that services are sorted. Condemned buildings, particularly in areas with black cotton soil, some parts of Kisumu West sub-county. Comprehensive assessment whether you have reached out to Department of Infrastructure, Energy, Public Works, or the need to conduct a comprehensive assessment of structural integrity of the condemned structures. Chair, we don't build. The Department of Health does not build. We have budgets to build, but the BQs, the building inspection, the supervision is done by Public Works. And therefore, this question, Chair, with a lot of humility, I would wish that it is done, it is responded to by the Department of Public Works. But the question is very kind to me. It is asking me whether we have reached out. Yes, we have. Reaching out, yes, we have. Sure. But as to the actualization of the answering to the challenge, it depends entirely, it's entirely in the hands of the, of course, the chair, and there are documents to show that we have asked them. We can't even condemn a building; it is them to condemn. As we see a crack like Paul, which dispensary is that? Where we asked them in the West, Chienge chair, and even Nyangande, where I come from, with Honorable Oiko, even Rabuor, even Nyangoma. Nyangoma is completely, Nyangoma is a whole building that I think we spent nearly 20, 30 million shillings to do during the provincial administration time. Those are they are called What Excellence, the ESP. What does ESP stand for? Economic Stimulus Program. A whole building is dead. You can't, even if you are not really endowed on matters infrastructure. You just say this is it, and that's why Nyangoma is not even admitting patients today. Nyangoma is in a very bad shape, but we are working on it. We have put some money for sorting it out this financial year, and Nyangoma will not be the same. Even my village dispensary, my village where Honorable Ito comes from, again we are sorting out the issue there. Chair, adequate plans, what plans are in place to engage engineering experts to assist in designing resilient buildings suitable for local soil conditions? Chair, I've responded to this. It is actually them. It is actually them. Acute shortage of staff. Number 6, could you please help the committee understand the efforts in your collaboration with PSB regarding 1, prioritizing staff recruitment and retention in the respective facilities? Chair, this is an area where the Department of Health and the Department of and the Public Service Board have worked very closely to recruit. This year, we recruited twice. Actually, the first part was we absorbed our staff that were being supported by a partner, CHEP. The reason we did this, Chair, is CHEP is our partner that helps us to sort out HIV in Kisumu County. We have a workforce in CHEP of around 500 people. And it takes time to train these people. It takes time to have them understand what HIV care is. HIV care is very special. So in the wisdom of the department and the wisdom of the cabinet, the executive, we asked the cabinet to allow us to absorb, was it 72? 72 highly specialized staff that were being paid by CHEP. We put them in our area. And that sorted us out because we created even more space on the other side to absorb, to recruit more. And then now we have people that can help us sort out. So with respect to recruitment, and then of course, we have also recruited nurses, clinic officers, physiotherapists, nutritionists. The number is about 150 that we posted recently. Even as we are speaking now, Chair, we are, if you read the papers recently, 2-3 days ago, we are recruiting some young doctors that we want to put on our workforce to help us as we grow. People are retiring, old people like us are on our way out, and we want to be replaced by young people like Dr. Don. So it is really a prioritized thing, and we are working very closely with the board. And we want to thank the board very much and this country assembly for giving that on this matter. Implementing a mechanism for regular workforce assessment and planning. This is work in progress. Workforce assessment. We have what is now called what do you call it? This thing where we put people in based on need. Yeah, output based. So now, for the past 12 years, yeah, this county has never had any direction on how many people in the Department of Health should be in job group S, how many people should be in job group D, how many people should be in job group K. But now we have a documentation that guided, even as the doctors were on strike here, even as the doctors were on strike, the department, in collaboration with the PSB, Public Service Board, were busy promoting doctors based on need, based on established numbers for particular job group. The other thing is, medicine is evolving, care of patient is evolving, life is changing. A lot of information is out there. We are very generous with our staff who want to go and improve on knowledge. As we speak, we have sent, I think, 20 or so nurses to Gertrude's Hospital in Nairobi for 1.5 years to learn how to take care of babies. Of course, they are trained nurses, but now we want them to be pediatric babies and very specific and focused. As we speak, we have a lot of our doctors doing postgraduate studies because we want to have enough gynecologists, enough pediatricians, enough surgeons, and even within the specializations, we also ask that people get super specialized. For example, you don't just say you are a surgeon like me. You a surgeon for what? Are you a urologist? Are you born? Are you a general surgeon like John Lucy here? Or what are you? So we are also investing a lot in improving our ability, and that responds to the very shameful thing that we refer patients to Moi, Eldoret and Kenya. We have nearly everything. What we may lack basically is the infrastructure and the hardware. But we're investing a lot. We know what we need, and we're investing quite a bit, except that a lot of those things are very finance intensive. And that's why we are still referring. Our referrals have really reduced in the last 1.5 years or so. Chair, and the other thing, Chair, is, you see, for example, doctor, I'll give you an example, and my director here, Don, is very keen on this. These days, you don't just tell us you want to be a gynecologist. We ask ourselves, how many gynecologists do we have? And how many pathologists do we have? And how many radiologists do we have? If we have one radiologist and everybody wants to become a gynecologist, I don't know what is even pulling them in that direction, then we say, no, the chances we have, we can only go support you if you are going to do, say, radiology or pathology. Don, I think when I finish, we'll make a little statement on that because we have tasked Don to talk to his age mates, to answer to the needs of Kisumu County. You don't just wake up, you want to be an orthopedic surgeon. We ask ourselves, yes, doing bones is good, but we need bones. For example, now, this county, we have one neurosurgeon. That neurosurgeon is employed by Maseno University. We have two of our very young, very sharp young doctors that we have sent out at the back, I think, in the next 1 year or so. One is even in Uganda, at Makerere University, and we'll be back to sort out, they open up our minds and see what is in the brain, so that we reduce referrals to Moi. Develop a comprehensive remuneration package. Remuneration package, Chair, depends on job groups and promotions and response to promotions based on one, availability of funds, two, the number of years somebody has worked, and three, of course, on what is your output. For example, we are currently promoting doctors, but those that we did not serve us very well, those that made us lose our mothers during the strike, those that made us lose our babies during the strike, I don't think we are going to look at them with good eyes when we're looking at promotion, because you may not have. For example, if you have 10 people who are ripe for promotion, but staff establishment, that's what I was looking for. Staff establishment. Establishment says that in your group Q, you only want 6. Apart from the interview, you want us for ourselves. Did you let us lose a month? But on this, Chair, again, I want to say that a lot of our doctors behaved very well, and we didn't lose. I think we lost two mothers, very unfortunate. One we lost in a private facility in where's that place? Masaba, and another mother we lost from this mother, I think, came from Riga. They are very sad stories. Very sad stories. As we sit here today. But we did our best. Our doctors are very supportive. Our CEC, the minister himself, is a gynecologist. At some point, a doctor was called to go and do surgery in KCRH. He was not found. The CEC himself woke up at 3 a.m. to go and do that surgery and help the baby. So, Chair, those are just signs that we are very serious. Chair, providing professional development opportunities to attract and retain skilled healthcare professionals. I think I've responded to this very adequately. Number 7, inadequate waste disposal system and threat to environmental and public health. I kindly enlighten this committee on the actionable plans regarding 1, purchasing and installing burning chambers in all sub-county hospitals. As you are aware, the initiative aims to enhance waste management practices, protect public health, and contribute to environmental sustainability for healthcare communities. Chair, we don't just want to build burning chambers. Burning chambers are being done. We do incineration. Incineration means we even burn things at temperatures of 1,500 degrees centigrade. Somebody once told me that is the temperature in hell. Yes. But today, our let's begin with town. Lumumba is a functional incinerator, very functional incinerator, and Jotarech as a very functional incinerator. We are taking care of all our waste, including blood products from the regional blood center. Kombewa has a very functional incinerator. Muhoroni and Ahero, we have built, acquired, and installed a very, very effective modern incinerator in Papunditi. That is, we commissioned that thing. Yes, that is working. The temperatures in that thing in Papunditi is 1,500 degrees centigrade, already commissioned. In this financial year, Chair, Kisumu incinerator is a bit wavy. It is shaky, a bit turbulent. So we have allocated, I think, 10 million shillings. Paul, is that so? 10 million shillings to do a serious incinerator for Kisumu County Hospital, and that again, once that those Moroni can sort out Ahero and Aponditi can sort out Ahero and Moroni, which also have burning chambers. But now we want them to take the things to the waste to indeed. At some point, we have a bit of challenges with ACRH, and the Lumumba was sorting us out very well. So, Chair, we are very alive and cognizant of the need to have very elaborate, deliberate, focused ways of dealing with the waste, because these are medical waste, extremely dangerous, extremely dangerous. Finally, Chair, this committee is interested in knowing, want us to address the issue of lack of title deeds to facilities, a real issue. And we have engaged with our lands department. We have done letters, Paul, and some of our facilities have title deeds, but a lot of them do not have. A lot of them do not have. And some of them have really embarrassed us. We've been really embarrassed by some of our facilities where we don't have a title deed. An old man gave land for a facility to be built, I think, in the year 1957. The son now comes and says that, and then we didn't do any due diligence. We didn't change things. The son now comes now and fences off part of the building, part of the compound. And even now, even in Kajibu here, we have an issue. We used to have an issue in Nyahera, but I think we have made arrangements even to pay. So this concern by this committee is a real issue. And this is why we are also, it cannot appear in our budget that we're buying land. You cannot be buying land when you're not buying paracetamol. So it must appear in the other budget. But we are collaborating, talking to the other department to make sure that we have our title deeds of this facility. Having said that, Chair, I must say that I appreciate the fact, that's lastly now, we really appreciate the level of knowledge and engagement that this committee has on us as we go out there to deliver our services. It is very exciting. It's been very exciting to discuss some of these issues with you. I want to ask that my two companions, that is Paul and Dawn, Dr. Dawn, if there's something that they think they should add, then if you allow, with your kindness, Chair, then you allow them to add. Paul?
Thank you very much, Madam Chair. Allow me to add concerning the condemned buildings. We are in the process of assessing all our buildings in all the sub-counties. We've gotten response from Nyakach, Nyando, and Muhoroni. We are waiting for the rest of the sub-counties to compile all the buildings that are not being utilized and to submit to Department of Public Works to do due diligence and inspection to give us the structural conditions of this building, after which we take necessary action based on the expert advice from the Department of Public Works. Number two, concerning the title deed, it's a concern to us as a department, and that's why we initiated the communication with the Lands Department to request to process the title deed. As we are speaking right now, over 60% of our facilities don't have title deeds, and currently we have even a court case in a facility called, an upcoming facility called Yatindegi, where the father gave up the land in 2020. Unfortunately, after the first phase of the construction of the roof, the old man died. And right now we are in court. The family claiming to be paid and claiming that county took their land by force. So it's a concern to us as it is to you, and we are working through all means to ensure that all our facilities are with the title deeds. And this is also our humble request to the House, that in our subsequent project, new facilities, we should not initiate until we get either the allotment or any documentation supporting the acquisition of these lands before we initiate any project. Thank you, Chair.
Thank you, Madam Chair and the honorable members. Just to add on one thing, on what we are doing to improve on our network for those peripheral facilities, we've had two vendors. One is called Signalytic. That came to the department. We've had that meeting with them so that they could help us in the network for the facilities which network are poor. However, we did not reach the agreement because of the sustainability of Signalytic was very high. They expected us to be paying them 72,000 per each facility per month. You realize that the smaller facilities that don't collect FIF and only depend on the Danida will not be in a position to be able to pay for Signalytic of 72,000 maintenance for per month of those facilities. That does not mean that we've stopped. There are many vendors, and whenever we get a good deal, definitely we'll get into agreement and go ahead, sign an MOU and see if we could have all our facilities well networked so that even the shift which is coming will not be a problem to us. Thank you.
Thank you, Chair. With that, I think we are done, Chair. So over to you again, Madam Chair.
Oh, thank you very much. Before we proceed, we have members who have just walked in. We have Honorable James Were, James Omolo, sorry. We have Honorable Moses Ochele. We have Honorable Peter Obaso, and we have Honorable Oiko Pete. You feel most welcome. Honorable Warindu is also with us. Yeah, thank you very much for coming. I would like us to continue with members. If you have any questions to put to Chief Officer Health and his panelists. Thank you. Yes.
Madam Chair, I have one question. You are talking about the network, and you are talking about Nyamarimba dispensary. Do you have a pay bill in Nyamarimba or Andingopanga?
Yes, Honorable Member. Nyamarimba is in our list of the last final 9 facilities that have pay bills. We invited them to the department last week, and just to show them how to use or what it means to have this. But again, as one of the questions raised by this very honorable committee, networking is a bit of a challenge. We said, let us begin and see how far we can go, and then we answer to the concerns.
Honorable Lawino Opar.
Thank you, Madam Chair. I have some concern on the condemned building as it has been put by our chief officer, is taking the blame to the public works and still is telling us that they are still going to facilitate some amount for other buildings to be put up. I hope I got you right. Now, we know that once bitten, twice shy. And you have been beaten so many times. You are still putting some money for the construction. What measures have you taken so that those things do not reoccur, because you have taken them to the public works? And also, when you put your money somewhere and you see that somebody is not doing the right work, is there any way that you can collaborate with that person so that you don't make a mistake? The second thing is about the backup system of the data that we have been told. We know that I think we have sinned and God is really punishing us. There's a lot of floods even where there were no floods. Now that you don't have the backup system, and suppose something happens, because you say you are still looking for some donors to come and assist you so that you can put these things in place. And we know that you collect money from the facility, and then it takes the channel that the chief officer has told us, and then back. Now, such a situation that you don't have a backup system and something happens, like the floods. We saw the floods in Ahero. In case of that, and you don't have the backup system, don't you think somebody can take what advantage of that backup system which is not in place, and just put up some figures which are not there? Now you'll just accept whatever amount that you have been given. And two, I just heard that you're trying to look for donors who are going to help you put up a building which is fireproof. What about these floods that we are now experiencing? Thank you.
Chair, with your kind permission, Don will deal with the backup issue and the protection, the fire issues. Let me deal. Thank you, Honorable Member. I want to say this, and I want to be very, very, very straight, that a lot of the buildings that are condemned are buildings that were done before devolution. In Paponditi, for example, we have two buildings there. They're a big shame. And one, I think, was supposed to be a mortuary. And even if you finger a wall, like putting a finger on a wall like this, it is regular, you know what I mean? It is, how can I say that in English language? It doesn't even peel off. That thing is like a posho meal. What happens? I don't know what that means in English language. But so a lot of them are very shameful. Even in my own village in Yangande, a lot of them were done by when during devolution. And then, this CDF, the ones that were done using CDF, before health was devolved to us. I am not saying that county governments are blameless. Even the one that we are talking about from Nichenge is in Kisumu West, where Honorable Jennifer comes from. That was done by us. Yeah. So, Honorable Member, we can't stop building because we are condemning buildings.
The measures.
For us, I think it's a learning curve. And of course, as I said, it is squarely, we are not taught how to do buildings, but we know what is bad. The other day I was dealing with Honorable James in Yakai, where somebody was putting a roof, and he bought mabati iron bila rangi, alafu anapaka rangi on site, because we say the iron should be blue. And then he puts the things, and the things are like, things that I don't know. I don't know how to say that again in English language. We said, pull it down. Pull it down. And Paul is here. It was pulled down. So, Honorable Member, we know what is not good. But the details of what is not good now is with public works. And we are not just sitting there passively waiting to be told by public works that in Imba is Imba, in Pesa is Pesa. No. We are also actively on the alert on what is good and what is not. So again, as I said, some of us are using those experiences as learning lessons, to the extent that we don't want to waste public money, because finally we are liable. You know what the rule says? If you supervised a building that is condemned in your lifetime in the civil service, the cost of that building is going to be deducted from your salary. That's how serious it is. So it is not something that one would really wish to go up and do. But we are also human beings. No?
Thank you, Honorable Chair, and the Honorable Member who asked the question on the backup. So, the backup, the data backup which I was talking about is not for Department of Health, but it is for the whole Kisumu County, which is headed by the ICT department. Every employee's data, all the patients that we have will have online data, which is digital, which therefore must have what we call a data center. This data center must be protected because it will carry all the details, including my details. This file we have in the HR is outdated. We will run away out of it because we are going digital. So that is the house which I was talking about. It is a data center which each county will have to develop. And it is a lot of money because it should be fireproof so that there should be no way that each data in the whole county will run out of data. And in Kenya, it is started in the Konza city. So it is a serious thing. If you go to ICT department, Kenya, their data center is at the Konza, it's called the Konza city in somewhere past Machakos. So in Kisumu County, we've had two partners. One is CHEB that will help us do the part, and another partner which also has promised to help us put this data center, which is the data, the backup, is the server, where all the details, all facilities, all from agriculture, all everywhere will come to that point. However, what we are doing for our daily, today facility returns, especially for the money which are paid. Number one, we've gone cashless. So doing cashless means that whenever you pay, that money directly go to the bank account. And each month, we surrender, each facility surrender their revenue to the county revenue board, Kisumu County. And they're given receipts of having surrendered those revenue. That revenue must therefore coincide with what we call the fund the software that we are using. And whenever there is discrepancy, they write to us to answer why there's discrepancy. And the last one we did was last Thursday, which has gone to the revenue, us trying to explain why there was this discrepancy. Therefore, this means that in the event there's flood, the only thing that can be affected is the hardware, which is the computer, but not the data inside. Because that data, so long as you pay, it goes direct to the account. And the account, you cannot withdraw account without account statement. Every time the account statement is taken to the revenue every month. And the revenue, therefore, gives each facility a receipt of having surrendered their revenue for that month. So each month, we do that. And reconciliation is done at the bank, at the revenue, and at the facility with the software that we have. Thank you.
We have a number of questions. That is just dealing with one question from, is it sub-county hospitals? Yeah. And we still have two more to go. So I request members that we note each and every question so that we go through the questions we have for them and then we answer them all at once because of time. For the chief officer, we would like your questions, your answers to be very precise, very short, And where you don't need to explain, then say yes or no. Explanation is good, but it's going to take us a century sitting here. So I would like us to cooperate in this. We have just dealt with one question, and we have 2 more to go, and probably 3. So I'm asking members if you're okay with that. We do the rest of the questions, and then now we note them down, and then we put all the questions to them before we let them go. Thank you very much. Yes, Bas. I hope it's not a question. I hope so.
It is. It is a question.
Honorable Basso, kindly sit down. Honorable Basso, kindly let us finish with this thing. How long is it going to take, this comment? It's not a very long one. Thank you.
Immediately 6 months after the end of the financial year, to establish the status of completed works, and then let the assembly make political noise. That is what will help this country. Like the Department of Health, when their health facilities are poorly done, they don't have the courage to confront their colleagues. It is this assembly to do that, and we shall help the country, because a lot of resources go to waste. Even now works are going on, poor supervision is there. And by mid next year, the public will be on our neck. Roads were not done, bridges were not done. So take up the matter, and then we make political noise. The department will wake up.
Well put, Honorable Oikopete, and I hope that has been taken in well with the Chief Officer and his people here. Honorable Warindu, what is it?
Madam Chair, kindly, I will propose that we don't have so many questions on this, and I would like you to give us just some time to dispense with this one, this first round questions first. Then we will go to the next round.
Thank you very much, Honorable Warindu. I don't know how many members are agreeing with Honorable Warindu. How you are there, but how many are you? So that we all of you want to take, okay. Oh, that is the way we are going. Then we can start with the bus, so then we come to Honorable Warindu. Thank you very much.
Thank you, Madam Chair. Madam Chair, I have a concern that I wanted to put across to the Chief Officer. And from what he was presenting, I've seen the effort they are making towards the enhancements of human resource in these facilities. And just the other day, we had a report in this house on from Papunditi Hospital on where a superintendent who was the one collecting money and also doing the administration works, also attending to the patients, And I think this rose some concerns. So I just wanted to request the chief officer and the colleagues to check into this so that we don't find ourselves where we lose money, because from that report we could see variances of some monies that were lost. So I think this one should be put in concern. So this is what I wanted to put across, where accountants should be deployed there, and other experts. Thank you.
Thank you, Honorable Basso. You can take up the question.
My question is also related to that. We had the privilege of interrogating the audited financial statements of most of our facilities. And we found that most of them had adverse audit opinion reports, almost all of them. One of the observations we made there, the department does not even have a registered accountant. They have a Roman accountant who is not even certified. Then from that, we also realized that most of the resources that are being transferred to the facilities are not prudently and responsibly being used. As the accounting officer, I just wanted to know the steps that you are taking as a department to help the situation. Kisumu County is tired of adverse opinion, and the health department cannot be a contributor to that. From those reports, again, you've been talking of cashless. We found out that some facilities are still collecting money manually. And the response they were giving is that they received a letter from the chief officer to do so. I hope you'll clarify that.
Yeah, thank you very much. You can take up the question.
Thank you. Thank honorable members for those issues that have been raised. One is that the medical superintendents do everything, seeing patients, collecting money, and it is the opinion of this committee and the assembly that accountants be taken to the facilities, and that we have had adverse opinion with respect to the reports from the Auditor General. True fact that adverse opinions have been slapped on us, and that one of the things which you rightly say, honorable member, is that we don't have accountants. You know, the structure of government is that accountants are secondary to departments. And this is something that we have constantly engaged with our finance department. And it is only after these adverse opinions became a public knowledge that now the Department of Health has given us some accountants that now are taking care of our facilities, but some of them are even remotely. Our desire, Chair, is that all our county hospitals, you know, Paponditi, Ahero, Muhoroni, Kombewa, Tulaimbo, Gita, must have accountants. Letters have been done back and forth asking for the same. But now, after it became obvious that what we are asking for is the reason that we have adverse opinions, now we have some accountants. But it is, again, work in progress, because there are our accountants, but again, they're doing some duties in second place. Nobody wants an adverse opinion. In fact, since I started handling government money, this is the first time that I'm coming face to face with adverse opinions where I'm involved. So we hear you, but occasionally, Chair, when you're dealing with the Department of Finance, raise these issues with them. We are doing letters with them. We are having discussions with them. But they also say, oh, we don't have. But accountants are very important cogwheels in answering to some of the issues. And again, the people that we supervise, some of them take advantage of this and then become very belligerent with the use of funds. And that brings me to the next question. We have noticed with concern that some of our facility managers do not have respect for government funds. They float procurement procedures in abandon. What are we doing about it? Today, we have done letters. Dawn, I think you can tell this Honorable Assembly some of the steps we have taken. We are even going into their salaries to refund the money. There is one from, I don't know whether I'm allowed to mention names, even facility. Somebody gets 27,000 shillings on a Friday. They were still using, I think Mr. Rindu is even from your village. This gentleman picks 27,000 shillings from a facility on a Friday. It disappears. He does go to the bank on Saturday to bank. It disappears for 2 weeks. His phone is off 3 weeks, 4 weeks. What do? I tell the salary department, let us pick the 27,000 shillings from his salary and then stop the salary. And that's exactly what we have done. We own these people. But as you know, even God himself would not come and deal with us on earth. He sent his son. So we're also dealing with these people. But they are human beings. Remember, we are not joking with these people. That I can assure you, Chair. That was the last question. I think that was it. That was it. Yeah.
Very much. Dr. Lucy.
Yes.
Chief Officer for Health. You have been mentioned, and I may say advanced mentioning, that you instruct some of these officials to collect money on your behalf. Is that true?
That is rubbish. That is nonsensical. Stings to the high heavens, not me. Yeah. I say that with a lot of respect to this assembly. Not Dr. Juang Lucy. My friends, not Dr.
It has been mentioned. It has been said.
Let them go to hell with those mentioned things. Let them go to the police. Some honorable members mentioned that I gave a letter telling them to collect money, cash. Can they produce that letter?
I think that is what we are going to ask for, if the letter is there, so that we also verify. At the moment, I don't think we have that letter. Thank you.
Chair, I'm shocked, but it's rubbish. How can Ojong Lucy do that?
I want you to take a question from me. We are approaching our third budget cycle.
Chair, be kind to me, please. Can I know who's saying this? And it must provide evidence. That is character assassination. I'm 6 years I became an MOH when I was 27 years old, of the great South Nyanza, including Nyatike.
Daktari, we are here to correct what is not right and to follow.
For you to bring that unanswered, you're being unkind to me.
Daktari, this is a committee on implementation, and that is what has been said. I'm only repeating what has been said.
And I'm telling you, for you to mention such a thing in public like this, you're character assassinating me.
What I'm saying, Daktari, is that it is not me who said, but the people who went around and found out all these issues are the ones who have mentioned you, not me.
Hell, not to mention such a thing.
Daktari, I'm not using any other thing. Actually, I'm using my head, and that's abuse. That is abuse, Daktari. No, accuse me as the chair of this committee, but not as the person who has mentioned you. Accuse me as the chair. Accuse me as the chair. Because you want us to have a quarrel in this house, which is not right. I've only repeated what has been said.
Chair, can you give us time?
No.
Can you give us time, Chair?
Come up.
Thank you, Chair, and our brothers from the Department of Health. Madam Chair, by name I'm Moses Ochele, MCA Kanawidi Ward. Chair, normally committee procedures, when a matter touching an individual, and more specifically coming from a known personality, it is just a good practice that with the authority, you have just confronted the department that you, Chief Officer, you've been mentioned by the MOH, you've been mentioned by a manager for this facility, that you've been instructing them to collect money. But Chair, if we want to handle a committee with hearsays and rumors, then we'll be setting a wrong precedence, because some of these officers, I've known them for a long time. I've known he was a friend to my friend, Dr. Gondi, and he was his senior. And I think they did a good job to this region. Nyanza province then, he was the MIH. And my friend, because of the good job they did with Dr. Lucy, is right now in a good position nationally, serving this country. Mr. Speaker, a person who has sacrificed his life and built a name, Mr. Speaker, I doubt if you can just have audacity to mention that he has been instructing those who handle 10,000, 20,000 to bring money to him. If he wants money, he has a lot of revenue. The entire money for the health docket is in his hands, Madam Chair. So I think there, Madam Chair, only the Chair don't apologize, but I think the approach is not parliamentary. And I want to agree with the Chief, is infuriated, and that is natural when something which does not make sense and touches on credibility of an individual is mentioned, and more so by a chair. So Chair, be humble, don't shout, withdraw, and allow Dr. Lucy to have his peace. Thank you.
Honorable Chele. Honorable Henrietta Bodo did not mention Chief Officer. I just want you to take that one first. Did I stand up and mention Honorable Chief Officer? I didn't. I only repeated because it was mentioned. What kind of words do you want me to say? That is why I've said that we are going to do our own investigations. We are going.
Chair, remember, this thing you are insisting on saying is going in the answered. And if you don't delete it, Madam Chair, it can lead to a serious ramification, because if you cannot substantiate as a chair, then you are leading this committee to a wrong direction. If you can't mention if it is a manager, MOH, and from which facility, then I think it can be treated as being personal to the chief officer.
Honorable Chele. I've been very, very lenient with the chief officer, and kindly let me finish.
Chair, let us engage.
Kindly let me finish.
Let your members speak, please.
Kindly let me finish what the statement had started. What I'm saying is that.
Point of order, Chair.
Let me finish. Let me just finish what I want to say.
Kindly.
Honorable Warindu said that they went round. It did not come from me, Chief Officer. It did not come from me. So I, as the chair of this committee, I just said that you have been mentioned. Thank you.
Kindly.
Chair, allow the answered person to expurge that bit. It is damaging. It is not good for someone's career. Allow the answered department to expurge so that we proceed.
Chair, before Warindu can speak.
Kindly, allow me to propose for an adjournment.
Just kidogo. Thank you, Chair. Chair, I think it is very simple. Let us not bring debate on a subject which was not on the table for us to discuss. I think if you mentioned Honorable Warindu is here. He can purposely repeat his statement. I didn't hear.
My statement was so clear.
Yes.
And it never talked about that.
And we can.
My statement was so clear.
Say that when they went round in some healthy facilities, it was claimed that the chief officer had written a letter allowing them to collect hard cash, not collecting for him. That is what Honorable Warindu said. And what you are insinuating is character assassination. Money is being collected for the chief officer. See. So, Madam Chair, you see, when people are in this kind of meeting, the character is very important. And if you didn't get a statement clearly, you don't cling on it. The best thing is you apologize and we proceed. And from what I'm seeing, it is also late. You can adjourn because the motions have risen.
I think if that is the way all of us want to go, then we can adjourn. But I'm still saying that after the statement was made, I basically said that we are going to follow up and see who said that, which letter was this. I think that was my statement. Thank you.
Madam Chair, I propose that bit of our deliberation touching on the character of chief officer be expurged from the answered. I may I request Honorable James Uyuere to second.
Thank you, Chair. Chair, I also rise on my feet to second that we expurge that statement from our answered, because it is a hearsay. It is not a true fact. And the people that we are dealing with have got families, they have got their integrity, and making false allegation within our answered will not augur well, even with the public that it serves. I therefore request and second that we expurge that from our answer. Thank you.
Let's proceed with the other questions.
Thank you, Chair. I want to apologize to Chief Officer. And the way we are going, I see everything we are almost finished, or we cover everything which we want to discuss here. Because our temper now is high, so I want to propose to finish this meeting, Madam Chair. I know Chief Officer is the straightforward person. Chief Officer, I request you to be patient and don't worry which we are come out here. But I want to request Chair to finish this meeting. Thank you.
Before we finish the meeting, we have a number of questions that we still want to put to the Chief Officer and his colleagues. I don't know whether you are comfortable for us to reschedule this time, or we finish with what we had. Thank you. I think we have to continue, and then we get done with this. So who was taking the honorable part?
Thank you, Madam Chair, but I think the tempers are not right for any further questions. I don't know whether my honorable members are in.
For members,
Okay.
getting time like this is not very easy.
Okay, it's okay.
Yeah, getting time as this we have gotten today is not very easy. So I would like us kindly to continue and we get done with this.
Thank you, Madam Chair, our Chief Officer and the team. Normally people disagree to agree, and I think we are in agreement that we continue, and I hope all will be well. Now we are still on the status of referral hospitals in Kisumu County, and issues that are emerging or are on collaboration with the Public Service Board on recruitment and workforce assessment. Now the first concern, please update the committee on the progress to expedite the recruitment and establish a framework for regular workforce assessment and planning. 2, have your department engaged on board on prioritizing the facility and partner contracted staff during recruitment to ease the hospital's burden of sourcing for human resource by saving money that could be used for other needs. Number 2, we are on establishment of ICU at Kisumu County Referral Hospital, staffing at the Joe OTRH. Can you update this committee on the short and long-term plans you have initiated to establish a well-equipped and adequate staffed ICU at Kisumu County Referral Hospital, considering its crucial role in providing timely and specialized care to patients with life-threatening conditions? 2, on the same, what plans are you currently implementing to ensure that your TRH is fully staffed and operating at its maximum capacity? Question number 3 is on collaboration with the Department of Public Administration and Governance on ME framework on construction contracts. To ensure quality work from contractors in your facilities, could you please provide this committee with an update, if any, on any initiative regarding the implementation of an ME framework by the Department of Public Administration and Governance for construction contracts awarded and assessment plan linking payments to verifiable projects completion? Number 4, Kisumu County Social Health Insurance Fund, that is MARWA. The House, upon its resolution, had asked you in collaboration with the CCM for finance and economic planning to submit the following within 30 days. 1, a comprehensive review of the fund's financial management and reimbursement procedures to ensure that healthcare facilities are reimbursed promptly for services rendered. This involves establishing a transparent and efficient billing and reimbursement process to prevent accumulation of unpaid bills so as to safeguard the financial stability of county healthcare institutions. B, the implementation status of the Kisumu County Social Health Insurance Fund, MARWA. Could you please inform this committee as to why the reports following the House resolution have not been submitted? 2, could you please update this committee on any progress made regarding the recommendation concerning MARWA? And lastly, is on collaboration with the CCM Finance and Economic Planning on conditional payments release system for contractors. Kindly update this committee if there is a mechanism in place on pegging payments to contractors on a satisfactory progress report from the hospital management to ensure accountability and compliance with certified qualified standards. Thank you.
On that note, we are going to, Honorable James Ojemo was to present some questions. If Honorable James is not around, then we can take up the questions. You can take the questions for responses. Thank you. I'm asking Chief Officer and your people to take the questions we have just raised. If you have answers to them. And if you don't have answers to them, then we can still look for Honorable James Ojemo to bring us more questions. Thank you. Honorable members, I'm hereby being informed that we are operating past our normal time. And so I would call this meeting to adjourn. Thank you.
Chair, before you call this meeting to adjourn, I would request that we submit these questions, the remaining questions, to our chief, so that they can give us even written submissions for our report writing. Thank you.
Man, there's a cookie side.